And you're live.
Good morning, everyone. It is Wednesday, April 9th, and we are here with Senate Health and Welfare Committee looking at H91. We've had a walkthrough of the bill with our legislative council. And so today we're going to listen to some of the folks who have been really critical and important in dealing with emergency temporary shelter, among other things. So we'll start with Lily Sojourner, who's up on the screen. Thank you for being with us, Lily. I know that you are at a conference and it's difficult to fit in everything, but we appreciate your taking the time to go through your slides with us. So why don't you go right ahead and you can put your slides up. Do you have share screen capacity down?
I think so.
So I'm not sure you know everyone around the table. We're going to introduce ourselves while you're getting organized. Go ahead, Senator Hart.
Senator Larry Hart from Orange County.
Sam Douglas from Orleans County.
Ginny Lyons, Chittenden Southeast.
Martine LaRock-Ulick, live in Burlington and represent Chittenden Central.
Ann Cummings, Washington District.
So Lily, why don't you go right ahead, introduce yourself for the record, and then we'd welcome your testimony.
Thank you so much, everyone, and thank you for accommodating my schedule. I'm Lily Sojourner, the director of the Vermont Office of Economic Opportunity. We're within the Department for Children and Families. Are you able to see the PowerPoint?
Yes, we are. You've got your slides on the side. You don't have full screen yet.
Okay, great. I just wanted to make sure.
Yeah.
All right, how is that?
Perfect.
Okay, wonderful. Thank you again for having me today and my colleagues at the Community Action Agencies and Vermont Network. Today, I'm going to talk a little bit about
Thank you.
the two of our programs at the Office of Economic Opportunity. We do more, including weatherization, but I'm going to talk today about the Community Service Block Grant and our homeless assistance programs in particular.
Lily.
Yes.
Lily. So your sound is a little bit echoey, and it would help. Two things would help. One, be closer to the mic. The second thing would be helpful is just to speak a little slower. That's it. And you just took your full screen away.
Oh, geez, please. All right. Is this better?
It is. Thank you.
Okay. Thank you for the feedback. All right. So I'll start with a brief overview of the Community Services Block Grant, which is a federally funded block grant to support services to alleviate the causes and conditions of poverty. It's a national program with over 1,000 agencies across the country. And in Vermont, we're served by the 5 community action agencies. I believe many of them have representatives with you today. In Vermont, in federal fiscal year 24, these agencies served over 40,000 individuals, and they provide services and supports really tailored to meet the needs of their specific communities. And I'm sure they'll talk a little bit about this too, but they leverage the approximately $4 million in the Community Service Block Grant to meet the needs of their communities with programs that include food shelves, utility help, free tax preparation, housing help, asset building programs, and much more. 4 of them are also weatherization assistance programs. Many of them are Head Start providers. They have shelters that they operate, so they really fill a lot of important key needs in their communities. And at the Office of Economic Opportunity, we play a role as administering and overseeing these funds. This includes a number of activities, but I wanted to highlight a few important ones. The community action agencies have annual work plans that are due to us each year, before we write the grant to give them these funds. These work plans are incredibly thorough. They talk about how they're going to use the money. They include an analysis of outcomes from the year before and their goals for the year ahead. They also then are sending us information on annual reports at the end of the year. And this all mirrors what we in turn do with our federal partners with annual plans that we're submitting as a state. The community action agencies also submit community needs assessment every 3 years, which is a thorough assessment of needs as well as resources in their community, assessing how poverty is impacting folks in the communities that they serve. We also have a pretty thorough monitoring role that we play with the community action agencies. We have an annual assessment of compliance with what's considered or called the organizational standards. This is a number of standards that address topics from board governance, financial practices, personnel practices, where we're reviewing the policies of the agencies to ensure really strong governance. We do every 3 years a very thorough programmatic on-site monitoring, so we're doing that this summer. So it includes the review of organizational standards, but it also includes, for instance, interviews with the board, executive directors, client file reviews. Again, very thorough monitoring that we do with these agencies. And then there are formal processes in place if the state was ever to pursue a termination or reduction in funding or de-designation of an agency. I'm gonna shift a little bit now to talk about Vermont's homeless response system. We at the Office of Economic Opportunity and Department for Children and Families exist within a larger response system. Vermont has two HUD is Housing and Urban Development recognized continuums of care, one for Chittenden County and then one for what's called the balance of state. And they really play a key role in terms of local planning and collaboration to meet the needs of those experiencing homelessness. And when we talk about homelessness, and I know this is a little challenging to see on this slide, but again, hopefully you have them and you can look at them more closely. There's HUD and Agency of Human Services definitions of homelessness as well as at risk of homelessness. And that's what really guides our work and those that we serve. So for instance, the homeless definition has 4 categories. Category 1, for example, is literally homeless. And so this would be people who are experiencing homelessness, sleeping outside, sleeping in a emergency homeless shelter, or other places unfit for human habitation. But there's also, for instance, an imminent risk of homelessness. So those who may be losing their housing within 14 days. So again, wanted to make sure folks had this definition for reference. And so when we look then for a snapshot of homelessness in Vermont, this is some data from the point in time count last year. This is something that's done annually. And this is an unduplicated count of those experiencing literal homelessness. So again, that category 1. And you can link to the report for Vermont and nationally. Unfortunately, we are seeing nationally that the numbers of people experiencing homelessness are rising as well. And so we're seeing some of those same trends, but that's, I think, important for the context in Vermont. So then in terms of how to access support, right? We have local lead agencies that are really that front door for people who are seeking support. You can see some of them include community action agencies, but then some of them are not community action agencies. And what these agencies offer as coordinated entry lead agencies is access when people are in crisis. And so coordinated entry is about ensuring access to services that is streamlined for households so they're able to access the assistance they need and for which they are eligible. It is mandated by HUD. It is funded directly by HUD, but also by the Office of Economic Opportunity. Each jurisdiction has their own coordinated entry committee, and they are the decision-making bodies for this process. So with coordinated entry, we're really looking at like what housing and services are best for the household. There's greater transparency and clarity around what's available. There's standard screening and assessment for for every client, so no matter what. And then there's sort of community agreement on where to refer. So it really is intended to help kind of streamline and orient the process. This next slide, it tries to visualize what we're talking about. And again, I know it's a lot, but hopefully you can see that if you start on the left, you know, you have people who are experiencing homelessness or who are at risk. They may kind of identify this at any of these access points. And so then all of these folks are oriented to say, okay, let's get you to this coordinated entry assessment. We're gonna all do the same screening and assessment. And so that might be an immediate crisis response if there's like immediate needs to be addressed, but then it is the completing the same coordinated entry assessment and being placed on what's called a local master list. Then this is really where the problem solving comes into play, where we look at the services that we have available, what the individual is eligible for, and start to make those connections with the goal of then connecting them to housing. And so this is a large system that includes some resources that are available through the Department of Children and Families. It also accesses broader resources. So I'm going to start to drill down and talk a little bit about housing assistance at the Office of Economic Opportunity. This is a link to the award, our award summary, so you can see in more detail what resources and which agencies are funded in each community. I'm going to talk mostly about the Housing Opportunity Grant Program. We do administer specific HUD funds for coordinated entry. We also administer the Family Supportive Housing and Permanent Supportive Housing Assistance programs. Those are both funded through Medicaid, intensive case management for people experiencing homelessness. And then we have some additional investments for your awareness. Over the past few years, we've had some one-time investments that you can see here. And then we've been administering the Housing Stability Services, which were federal COVID era funds that are ending this summer. So to talk about HOP, the Housing Opportunity Grant Program provides funding to an array of services for those who are experiencing homelessness or at risk. So this includes emergency shelter. This includes some transitional housing programs where appropriate for really specific populations. So primarily young adults, youth is where we focus those resources currently. Rapid rehousing is a program to help those who are literally homeless move as quickly as possible into permanent housing and achieve stability in that housing. We also have some homelessness prevention programs that are used to prevent an individual or family from becoming homeless so that they can regain stability in their housing. So just to continue this list, I mentioned coordinated entry. We use state funds to help support the coordinated entry system. We also have flexible financial assistance. So this is short-term or one-term financial help for individuals and families. So it might be security deposit. It could be like rental assistance, maybe a utility deposit. Those are some examples. And then we administer the Homeless Management Information System and the comparable database that's used for victim services providers. So this includes the license fees to use the data system, technical and training support. And those are the primary activities that we have. And you can see that in this fiscal year, we've awarded almost $40 million to 35 nonprofit organizations. This amount, though, just to make sure, is a combination of base and one-time funding. So for instance, we received $10 million this year in one-time funding. So just to kind of acknowledge that it is a combination of both state, federal funding, base and one-time funding. You can see here that how that funding is spent, and the clear majority goes to emergency shelter projects. That's the green. And then you can see the direct financial assistance and coordinated entry are the next larger categories. The program has grown quite a bit in the past several years. In 2025, the base funding was actually 26 million. So you can see that it continued to grow. Really, I think, just the shared, I think, response that people have had to the numbers of people experiencing homelessness that we saw really jump around this time of the pandemic. So we really appreciate that support. In terms of the process, we have an application and funding process, over the winter or, January, February, we at our office look to see if we want to make any changes to our notice of funding. We release that funding in early April. Applications are due mid-May. We review and negotiate budgets and scope of work. And then really, it's a race to make sure everyone has their funding by July 1. So we evaluate applications based on local need, capacity of the applicant, approach, local coordination. We look at the criteria outlined in the notice of funding, the history of the applicant to effectively serve folks, and really looking at the requested amount, available funds, and then strengthen the application on and demonstrating whether or not they've met the criteria. We then also have a pretty robust monitoring process. We have our standards and guidance for each of those eligible activities that I talked about. So this speaks to eligibility, admission, the need for admission policies, discharge policies. We have habitability guidance for our shelters. There are record keeping requirements, requirements around reasonable accommodation, confidentiality. So all of that is listed in our standards and guidance. And then we monitor on those. So annually, we're monitoring all shelters with a habitability inspection. Approximately every 3 years, we're doing a programmatic monitoring on site where we're reviewing all relevant policies, doing a client file review. And then we do fiscal monitoring. We review quarterly financial reports, but then also, again, every 3 years are working with the internal audit group here at AHS for more in-depth fiscal management. That was a lot. I can stop sharing and then happy to take any questions.
That was a lot. I think we have to go through this about 5 times to really get versed in everything that you have here. I think there are a lot of questions, and we will have you back in another day when you're here, when you're able to be here. I think that would be really helpful. In the meantime, I do have a couple of questions. They're really the higher level questions about what you're hearing from the federal government about the block grants or other funding, HUD funding. Are you hearing anything about a loss of those funds, a change in the guidance or rules or criteria for the use of those funds? Can you share that a little bit?
Yeah, thank you for the question. Like a lot of our colleagues, communication has been limited and kind of shifting sometimes from our local counterparts. For a while, we weren't hearing from anybody. At HUD, we receive the Emergency Solutions Grant and then a Continuum of Care grant. We had both of our program officers suddenly, resign several weeks ago, and so we've scheduled regional events were subsequently canceled. So we're not receiving a great deal of communication. We are getting communication in terms of more of the like administrative things. If we need something signed or to close out a grant, we'll hear from them. We are in the process of working with Department of Housing and Community Development on the 5-year consolidated plan, which is a requirement for the Emergency Solutions Grant. We have not received significant instruction change on that, but it will be interesting once that's submitted in May to see if we get a different response. HUD did eliminate a majority of their training and technical assistance providers, although the provider that we work with, that was one of, I think, 2 that they kept. For Office of Community Service, our contacts there are actually out of, oh, and I'll just say for HUD, it's approximately $2 million a year, like $700,000 for Emergency Solutions Grant, and a slightly more for the Continuum of Care Coordinated Entry Grant. We did get an initial award notice for the Coordinated Entry Grant, but we haven't received like our final award. So we are waiting to hear on that. For the Community Service Block Grant, our contact was not out of the regional Boston office, because I know the closure of that office really impacted a lot of my colleagues, but is instead of out of Washington, D.C. We still have that contact. I do think we're watching very closely. It took a long time to get the second tranche of funding released this year, and the third tranche has not yet been released. And so we are watching that closely. I think we did also get some guidance on some data changes that they wanted in terms of the annual report that we just submitted. I think everyone's very closely watching, what will come over the next few months. The Community Service Block Grant has been around for, 60 years. And I think, really, along with programs like weatherization, utility assistance, I think can get a lot of diverse bipartisan support, but, it's unprecedented times. And so I think we're just watching everything very, very closely.
Okay, thank you. It'll be important for us to stay in tune with that, and I know that we will do that. Okay, so one of the slides that you had indicated that the emergency shelters are by far the largest cost, and that has increased. So when we talk about emergency shelters, how would you categorize the use of those shelters? Is that the adverse weather use, or is it ongoing throughout the year?
So the emergency shelters funded by the Office of Economic Opportunity are community-based shelters. A majority of them are year-round. So they run 365 days a year. I'm just looking to see if I can pull up some other data on them, but they include a range of different types of shelters in a few categories. So some subset are for those experiencing domestic violence. A subset are for families with minor children. A subset are for young adults. So late teens, early 20s is a separate category. And then the remainder are for, just adult individuals. And I think we only have 2 this year that are just seasonal. I'm just looking to see if I can pull up slides that give a breakdown. We have 650 capacity for 655 households right now. And yes, so okay, we have 4 seasonal shelters. 92% of our shelters operate year round. 65% of our shelters are considered semi-congregate. That's a question that people have, like, what is the type of facility? So semi-congregate means a location where households have their own private sleeping space, but often have shared common areas. So like bathrooms or kitchen. 23% are non-congregate. So that would be like each household has their private space, private access to bathrooms. And then sometimes it could include like kitchen and living space. And then 12% would be considered congregate. 23% of our shelters focus on domestic violence, those experiencing domestic violence. 14% are for the young adult population. 14% are families with children. 35% are adults only, and then 37% are both families and adults.
Can you send us that information? That'd be
Yeah,
good.
I can.
All right.
Yeah, I can send a PowerPoint that or a presentation that I did specifically focused on shelter.
Okay, thank you. My last question for you, because I think there are folks in the room who want to fill us in and educate us a little bit about their own work, and we are moving toward understanding what's in H91. And we will have you back to talk about H91. This committee has a little bit of a ways to go before we actually dive into markup on that bill. But my question is this: as you're working with the homeless population and obviously linking in with moving people into more permanent housing, how quickly is that happening? Are you seeing the investment that we've made in housing showing returns for people who need that housing? In other words, are we seeing a decrease in the not a decrease on your little graph, but are you seeing a reduction in folks who are people getting the homes they need based on the investment we put in place?
Thank you. And I think that investment in housing is so important because really homelessness is a housing problem. In communities where they have higher vacancy rates, they have more housing, they just see less homelessness because people are able to get in. I think those investments have been incredibly important. And I think we do see successes with people getting housed. I think that as, you know, and Commissioner Farrell and others at Department of Housing and Community Development could maybe talk more specifically. We still have a long way to go, and we still have a big hill to climb in terms of hitting the targets that we need to kind of make up for the housing. I think the housing needs report that they put out showed, 20 to 40,000 homes that are needed in Vermont. So I think those investments are critically important, and we're still in progress, I think, to then really address the needs of those who are experiencing homelessness.
Okay, I'm going to save my last question for another time, but but I think Senator Buick, you had a question.
I do have a quick question. There was a really great article, I believe it was in the New York Times recently, about how the housing crisis in New York is so severe that folks who are making $50,000 a year and are living in congregate and semi-congregate shelters across the city because they have nowhere to live. They have no homes that they could buy or apartments to rent. So my question is around the emergency shelters. Are there rules that govern how long folks can stay in those shelters? Like there are with like the motel program? And no, I see people saying no.
We have the HOP standards and guidance does have rules that if shelters want to have a policy on length of stay, expectations on what that would be. So shelters don't have to have a length of stay policy. And then if they do, we have some requirements on that. All shelters, when they're working with folks, those folks have individual housing plans. And so then those plans would really guide the goals for that household. I do think that shelters would say, unfortunately, there are folks who are doing kind of everything they need to do on their plan, and it really is just a matter of finding an affordable, safe unit. So again, it's not the same as the hotel program. Shelters do have the option of whether they have a length of stay policy or not, and then we have guidance if they do have a length of stay policy. But across the board, to be in a shelter, you're having an individual housing plan, and the expectation is that you're working with your provider on that plan, and that again is really meeting your specific needs to address your housing barriers.
Okay, thank you.
Lily, thank you. One more question from Senator Douglas, and then we're gonna move on.
Thank you, Madam Chair. Hello, Lily. Thanks for the presentation. And I apologize if you already addressed this during your presentation. But with the emergency shelters that you have, that Senator Gillick was just asking about, you said that they have plans when they come to stay there. And are there case managers that work with them while they're there? Do they get assigned to somebody? Do they have people that they work with to try to get services if they need services? And if they have that plan, and they have those people working with them, if they don't follow the plan, if they don't live up to what they agreed to, or if they're, if they're given a rental application for an apartment that somebody's able to find for them, and they just don't want to fill it out for whatever reason, what sort of practices or policies do you have for the shelters in that instance?
Thanks. There are staff on site that are working with the guests on site and able to provide at least a minimum level of case management. There is the expectations that shelters are providing what's kind of considered essential services, which is again addressing that housing plan and then making referrals as necessary. I think this is where it's really important, that plan and the expectations when people come into shelter and how that they're then engaging and really identifying what is going to be a successful option for someone. And this is where just like the skill of shelter staff is so valuable, to have these conversations with folks and make sure that they're ready, so that when they do find a place, they're feeling prepared and that it's something that works for them. I think that, in terms of, I think those situations tend to be rare. I think, again, if someone finds an apartment, people are really leaning into like, how do we make this work? How can we get you there? I think people are often excited to get into an apartment. And if there are hesitancies, folks are really going to talk with them and talk about like the consequences of if they don't pursue this option, because there's, may not be other options out there. In terms of involuntary terminations, though, we really do try to reserve those for issues of egregious violations of health and safety of the space. Shelter is really a life-saving intervention to protect people from the risks of being unsheltered. And so that's what we want to balance this with, is not exiting people unless, again, they're really jeopardizing the health and safety of the shelter, but at the same time, like really leading into conversations with folks and doing that like amazing work of making sure people are ready when an apartment becomes available or when another housing choice becomes available.
Thank you, Lily. Thank you for all you do.
Do you want to hold it, or do you want to ask your question, Senator? It's okay. Well, Senator Cummings has a question or frustration.
We've been going through this seasonal housing, putting people out in the street since COVID. And every year the administration says we've got all these wonderful programs that, are there and working with people. And if we have all these wonderful programs and everyone's getting case management, then why do I have a motel full of homeless people at the bottom of my street? I mean, we've got a gap here, and I'm trying to figure out where the gap is and what we do. And I am very nervous about putting all our eggs in the CAP basket. I chaired my local CAP board during the Nixon administration. I know, it's ancient. And I remember being shocked when he sent me a campaign brochure at my address at the CAP, which he was actively trying to defund. I thought it was kind of brazen. But CAPs were under attack, and those attacks were nothing like we're seeing now. I'm really concerned that, you know, with a reality check that we've got more serious problems coming. And I think we need to talk about what are we going to do?
We are.
Yeah.
That wasn't a question.
Yeah, that was a.
It's shared by many of us.
Yeah, everyone in this, I think everyone in this room is very sensitive to what you just said, Senator, and on the screen, it's,
I know this, everybody's working as hard as they can.
yeah, as hard as humanly possible, given the affront we're facing from Washington. All right, so Lily, thank you so much. And we will have you back. We do need to dive into H91 with you and hear your thoughts and work with you on that. And we're taking testimony today from folks who are also going to help us with that bill. So thank you. And you can stay online as long as you like, but I know you probably have other things that you're interested in doing. Thank you.
Thank you so much. I really appreciate the time and I look forward to coming back.
Thank you very much. Okay, so we're gonna move along. Our time is, we are getting the bill today, so crossover was what, March 14th? It was a while ago. It was like almost a month ago. And we're just getting the bill. And so we have very short time. My ask of everyone who's going to testify is this: be concise, be efficient, be targeted, and particular on what you currently do and what you would do under H91 and why you agree or disagree with specific sections of H91. And if you need to provide us with more discrete comments on the bill, we'll do that. I'm not asking you to go through section by section, but I'm asking of you what your role is and what your role would be and why you think this bill is important or unimportant, period. Okay, so you got it. We have to be this way right now. We don't have the time, but we also are very interested in making things work. And as Senator Cummings has said, we've been working on this a long time and we'd like to bring some closure somewhere. So we're going to start out with Jenna O'Farrell, Northeast Kingdom Community Action. Here you are. Thank you for being here.
Thank you. Okay.
And my question is, as you come up and you introduce yourself, if you have any testimony that you have submitted, just let us know. And if you haven't submitted your testimony, please do that.
It's under my name, Chair Lyons.
Good.
Posted it already.
All right. Terrific.
I also brought with me some information about the apps, which.
They're taking your seat, so you better.
We can get those around.
We're gonna play musical chairs all morning. We don't-
So thank you. For the opportunity to testify today. I'm Jenna O'Farrell from St. Johnsbury, Executive Director of Northeast Kingdom Community Action. Is also referred to as NECA. NECA serves Caledonia, Orleans, and Essex County. And every county in the United States is served by a community action agency. Today I'm offering testimony as president of our Vermont Community Action Partnership. And on behalf of my colleagues who are also available for questions, that's Allison Calderon and Sarah McMullen from Capstone, Paul Dragon from Champlain Valley Office of Economic Opportunity, or CVOEO, Tom Donahue, Bennington Rutland Opportunity Council, or BROC Community Action, and Josh Davis, Southeastern Vermont Community Action, or SEVCA. We share similar concerns around the federal environment and Our CAPs all serve different places and spaces in Vermont, and our portfolio of services look a lot different. I think than they did in Vermont Nixon era. I think we all started with a Queen's Spot grant, and we're all we're built out very different as time. Vermont Community Action Partnership feels a deep sense of community responsibility for the success of H91. Our 5 community action agencies are community-based, and our mission is to address the causes and conditions of poverty. We see the work of VHER well within our mission, and we'll be honored to the opportunity to work with state agencies and departments and our community partners to transform our system of supports and services for people at risk or experiencing homelessness in Vermont. We want to say at the outset of this current situation we're facing in our communities is untenable. Vulnerable Vermonters are being exited from hotels into the snow and cold. We want to work towards a future where people will not be exited into unsheltered homelessness. Lily offered a little background, and I'll talk some more around our community action agencies. We are a state association. We were incorporated in 1978. Our 5 agencies operate through federal, state, and private funding to provide programs and services to Vermonters with low or moderate income. We were established through the Economic Opportunity Act, 1964, by President Lyndon Johnson. We came into being in 1965 to the first state Office of Economic Opportunity created under Governor Phil Law. We continue to work hand in hand with Vermont Office of Opportunity, Economic Opportunity, and the legislature. We're in the front line of poverty. Through short and long-term strategies, VPAP and Vermont Community Action Agencies are recognized leaders in providing individual families and communities with the tools, skills, and vision for needed economic, racial, social, and environmental justice. We do have some thoughts on H91. We are both energized by the potential we see in H91 and concerned about the questions this bill raises on the transition to be heard and how that would happen. In this testimony, we'll ask some questions, make some suggestions, and offer our ideas on this transition rollout. We want to say clearly that the work of our community partners are doing on the ground right now is critical, and we need to all stay engaged with each other as planning and implementation moves forward. We hope that our partners will be engaged in your legislative process as well, and that we welcome their suggestions and concerns as you do your work on this bill. Any future success will be the result of our community partnerships as well as full engagement of state agencies and departments. We believe that the state of Vermont, our government, and our people can and must make the choice to shelter and support every person in Vermont. H91 would be a decisive step in that direction. We believe the work and vision for the community action agencies in H91 fits well within our mission and our statutory guidance. Although we'll need to ramp up into this work, we do believe we'll be able to do it along with our community partners if we have enough time and financial support that's available for us to be successful. We do have some concerns about the ramp-up process as it's currently outlined in H91. We believe that the potential of the H91 is to build upon our current system and create new solutions that will be more comprehensive, client-centered, and improve long-term outcomes. We want everyone who needs support to stay in their homes to get that support, and we want everyone who needs shelter to both get shelter and the services that they need. Empowering communities with the flexibility to be creative in their approach may allow for people to get the services and shelter that they need in their own communities and in a timely way. However, we know there is not currently enough funding in the system to allow for people who need services and shelters to be adequately served. Simply shifting the responsibility to the community level will not serve the issue of inadequate funding and resources, even if it adds more flexibility and creativity. Adequate funding must be available for both the transition period and implementation of the VHER program. We have concerns with the timeline. The implementation timeline in the bill is confusing, and we believe it is too short. We'd like to think that H91 sets up us and our communities for success. That is not quite true yet.
Can I ask you a question right there? So the timeline, that means that next year, when it's a transition year, you're suggesting we continue for what, more time with the current program?
I think you have the timeline.
There's a
Yeah.
visual that goes with what.
Yeah, okay, we don't, I'm not looking at it right now,
Neither am I.
but, no, but the question I'm
Yeah.
asking is, then we're looking at 26 as the year where we keep doing what we're doing essentially. And so you're suggesting extending that. Got it. I mean, for some of us, that increases our level of frustration, but.
I think you'll get clarity if you let Jenna walk.
Okay, for the record,
Sorry, Amy Schollenberger, lobbyist for VCAP. And I think it'll help if you're looking at the visual while Jenna's talking you through it.
all right, we'll look at it. Go ahead. Go ahead.
I'm trying.
Yeah. I love it.
I'm sorry.
I'm at the bolded language in the middle there. It's great.
Great. We have several questions, so we'd like to highlight. Is that where we're at?
Yeah.
Thanks. How would the advisory board recommendations intersect with community and the needs assessment and our community work plans? How will statewide board work with the community local community action agencies that are building this capacity for community planning and engagement with our partners? DCF is required to present an implementation plan to the legislative committee by February 1st, 2026. We're not clear how that can possibly include our regional plans done with our partners in that time frame. Is the DCF implementation plan the same as the statewide plan? You know, how do the local plans intersect with the implementation plan and the statewide plan? DCF is directed to work with us, the community action agencies, to develop accountability measures and plan to allocate the funding in FY27. We would need to have that information in our regional funding allocations before we can develop our community regional plans. All the above leads to the abrupt end of the current programs in the beginning of the new VEHRT program on July 1st, 2026. Our ability to produce long-term success and meet the goals of H91 will be significantly compromised by this timeline. And we have recommendations. Our recommendation is for OEO to continue the HOP grants, that's the Housing Opportunity Program, for 2 more years, FY26 and 27. If a project is ending, OEO would be responsible for the new grants until the end of that 2-year timeline. And here's what we envision. The hotel motel part of the funding could go to the community action agency region starting in FY27 and would be used to shift the current system into a new VEHRT system for the regional plans, which will be developed in FY26. Prior to the FY27 shift in funding, community action agencies would work with DCF, OEO, and community partners, including our continuum of cares and local housing coalitions, to build a plan for FY27, sort of people who would be seeking shelter and services. During FY27, community action agencies would conduct a full community engagement process and a needs assessment to build an implementation plan for each region for the full shift of VEHRT in FY28. This would allow for a holistic approach to planning in order to accomplish the goals of VEHRT program that are appropriate for each community. In order to do this, everyone needs to know the intention for funding for at least the next 3 years. We understand that VEHRT is not intended to fully eliminate homelessness, but to develop an integrative, creative, flexible, and responsive community-based regional system that better meets community client needs. However, we can engage our regions in a broader and deeper discussions. We may find innovative and creative solutions that may not arise if we limit our discussions to serving only some of the people who need shelter and services. In FY28, all the funding for VEHRT could go to the community action agencies as outlined in the bill. During FY27, part of the planning process would include the allocation process for the full amount of funding to the 5 community action agencies in our regions. In FY28, so funding can be considered in the planning process. Also, this part would be creating a system so community action agencies could use some of the funding to run programs directly if needed and requested by the community, and to grant and administer funding to other community providers or pay hotels or other entities. Community action agencies will need to work with DCF and OEO to ensure the accounting monitoring systems are acceptable in order to accomplish the directives of VEHRT. Advisory Committee.
So hold on here. Just, can we stop for a second and ask some questions? Are you okay with that?
Well, I'd like to finish, but it's okay if you want to ask.
Yeah, I did.
Okay.
Timeline and writing, right?
The timeline
Yeah.
is there. I looked at it and I get it, understand. But my question is, so you've got a lot of planning going on in here, and we heard that there's already plans in place doing a needs assessment.
Mhm.
So I'm trying to sort out the difference between what this planning is and that current planning process that goes on. And just speak to that briefly.
So as community action, it's gonna come up again in my
Okay, so I'm ahead of you, so go ahead.
Okay.
No, go ahead. If it's gonna come up, don't,
It does come
yeah,
up.
don't take the time.
Okay.
Yeah.
So our next question or concern is around the advisory committee.
Okay,
We would also like to highlight some questions around the advisory committee that is written in the bill. We don't understand how the advisory committee is meant to interact with DCF and the community action agency as part of a planning process. The advisory committee has several questions to address, but no timeline for addressing them. We also would want most of the planning to happen in the communities, and the community action agency to put our energy into the local plans. We don't quite understand the added value of the statewide advisory committee. Several of the items that the advisory committee is meant to advise DCF and the community action agencies on may better lead to rules or guidance promulgated by DCF. We are wondering if it would be better to have a more robust rulemaking process that leads to these rules or guidelines, such as stakeholder engagement prior to draft rules, extra public hearings along the comment period, review by House and Human Services, Senate Health and Welfare Committees before rules are promulgated.
so what you're saying is, can you tell us what the overall recommendation is for H91 relative to the advisory committee?
That we have a local advisory committees that the
You
five
don't need to have the advisory committees as currently written. That's one big help for us.
So community action agencies, we partner with the Office of Economic Opportunity, as I said in the introduction, and Lily had mentioned that well. We firmly believe that the ongoing engagement and support of the Office of Economic Opportunity is essential to Beaver being successful. It is critical that the state government's responsibility to address poverty and shelter people who need shelter is not displaced. First and foremost, we believe the duty of the Department of Children and Families is to act as a true partner and collaborator in the new system that will be Beaver. OEO has been our collaborator for decades. We strongly support the continued expectation of collaboration with OEO. In fact, we can't imagine the VHERD program being successful without the continued connection to the well-established expertise that OEO offers. We also believe that OEO should remain as a separate office within DCF or a standalone office within AHS. The Economic Opportunity Act 1964 created the Office of Economic Opportunity and new program initiatives, including the organization of community action agencies and community action programs. To stimulate better focusing on available local, state, private, and federal resources upon the goal of enabling low-income, moderate income families and low-income individuals of all ages in rural and urban areas to attain the skills, knowledge, motivation, and secure the opportunities needed for them to be fully self-sufficient.
Okay, you're gonna talk about it next. I'm not asking you.
Okay. The community action agency and the Office of Economic Opportunity were created together both federally and state level, and the partnership between both in Vermont has been one of trust, collaboration, and accountability. Our federal funding from our community service block grant does go through OEO, and it's dependent on our annual work plans that we create and submit to OEO. OEO provides technical expertise and oversight for the community action agencies and is connected to the National Community Action Partnership. Our National Community Service Block Grant, CSBG standards, drive our work, and we adhere to them through a process of results-oriented management and accountability, which we're all invested in. We must adhere to these standards and the ROMA, we call it results-oriented management accountability process, to receive our federal funding, and we work with OEO's oversight and technical expertise in this process. Our community service block grant standards already require a community needs assessment every 3 years. So every 3 years, we, in the regions that we serve, do an in-depth community needs assessment. The OEO functions as monitoring and accountability and should continue in its capacity when VHERD goes into effect. This oversight will be critical to our success and will help serve to keep the ultimate responsibility with the state government.
Can I will ask a question here. I don't see it there. So you have Roma, right? And you have guidelines and responsibilities for the federal government. And if the state puts additional requirements in place, do you have to go back to the federal government and explain what those are, or is that totally separate?
No, that would be separate.
Yeah, okay.
Where are we?
We are right in the middle.
then the paragraph that starts,
Page 4 of 5, moving toward the bottom.
paragraph that we also want.
Got
We also want to say here that if the legislator wants the community action agencies to take on this work, we'll need to know that the state supports us in doing the work. We do not support the language in the bill that suggests that any time DCF can decide that one or more of us should not be doing the work. This language can be found in section 2209K. DCF must be a partner with us and be willing to support us if it's being made for one of us to address issues. Of course, we have asked for continued state monitoring and will continue to be held to the highest organizational standards that we are now under OEL and our CSUG grants. We support the expanded use of Vermont 211. We believe that it's appropriate to expand 211 as another way for people to enter in to the system for support. It cannot be the only way into a new Beaver system, but it should be available to call 24/7 as one where people can always go through to get the supports and services they need. We will note that 211 would need to be funded appropriately to ensure that people can get the referrals that they need. And we encourage you to ask them if they would need to provide these services. Regional needs assessment, we would support the inclusion of homelessness issues in our regional needs assessment, which we currently already do. We are already required to do the community needs assessment every 3 years and the bill as passed by the House would require us to include Beaver topics in our needs assessment. And then that information would create our regional plans. Our needs assessment process is robust and we welcome the opportunity to do this work closely collaborating with our local housing coalitions, including Continuum of Care and other community organizations, individuals, and businesses. Guiding principles for regional planning. We believe in eliminating the confusion of conflicting timelines outlined above and moving towards the inclusion of a framework of guiding principles for regional planning and build with better lead to a stronger statewide plan. We have not had the time to do a full process for these suggested principles. However, we offer this as a place to start and get feedback from stakeholders. The idea would be that each CAM, Community Action Agency, will lead a regional planning process that would adhere to these principles and address them in the regional plans. So there's 6 bullets there. Provide equitable and timely access to emergency shelter through the use of coordinated entry system. Provide integrated person-centered support services. Provide shelter and support for dignity and safety and include a required housing plan for everyone. Strengthen regional capacity through planning, collaboration, and accountability. Promote dignified trauma-informed culture responsive care. Integrate systems to address root causes of poverty and homelessness. In terms of funding, the 5 community action agencies have collaborated to build budgets for the transition period. Again, we've had not a lot of time to think about this, but we have a good estimate of what it would be needed for us to successfully transition in FY26 to be ready for the first phase of Beaver as outlined above on the July 1st, 2017. We would note that this funding would need to be ongoing for the foreseeable future as this transition will not abruptly end on that date. And most of the funding is for the staff consultants that would be overseeing the work. Will be the total needed for us to work together, 6.83 million. We realize this is slightly more than it's currently budgeted in H91, but it's essential that we are adequately funded to successfully prepare for this new work that we'll be doing for the state and with on behalf of our partners in the program.
Okay, thank you. This is great. There are more questions, I think, than answers right now, but for us, we don't have the answers. We have the questions. So I do have a question. So essentially what is here in the bill is a real increased responsibility to CAPS for homelessness, period, right? And so you're receiving money and you're distributing funds for others to reduce homelessness. What is in the bill in terms of accountability to ensure that the outcomes are a reduction in homelessness? Is there something in there? And what do you see as a measurement that we can use? Because there's a lot of money here, right? It'll be ongoing. So what are the outcome measures that we can use? Do we say, every year, we're going to see a reduction in the number of people coming in who need permanent homes? Every year, we're gonna see a reduction in the number of people who are homeless? How do we measure your success with this? Is that something you can speak to?
I think so. See if anybody.
Are we gonna go,
Speak
is
to that, or-
everyone on the list gonna speak today? That's my question. So let's have that conversation then, because we've heard a lot of information today. And I'm sure it's not all in here. I mean, it's not all embedded in our brains by any means, but it would be helpful to, hear your thoughts. And you've said $6.83 million a year. What is currently in the fiscal note? I have the fiscal note.
That's fine.
What is it?
It's 6.5 is what has been allocated for.
Madam Chair, may I answer? Amy Schallrunner for VCAP. What's currently allocated in the appropriation section of the bill was 6.5 million, but some of that is meant to go to the network appropriately for the work that they are going to do, and it was not
Right.
specified. And I know someone from the network is here and could say how much they might be needing as well.
So. Yeah, there's a lot more in here. That. But. All right, we'll have to go through it. 6.5 for distribution of community action agencies and statewide organizations serving households, 500,000 for transformation, 3 million for shelter capacity. Okay, I got it. I'm going to the principles.
Yeah.
Oh,
You win. Hopefully we'll see them here.
you're lucky.
I don't get
God,
attention.
no. We don't want you to go. Okay, so I'm trying to understand. So as a group, the CAPS are supportive of H91. Only thing I heard is you don't like the advisory committee the way it currently exists. Is there anything else? And are you coming back with specific recommendations on the language in the bill?
Good.
Yeah, that would be helpful. That would be really good. Betty, so Senator Hewlett, go ahead.
Thank you. This is amazing. Thank you so much. I really appreciate the work that you put into this testimony. I live in Burlington and I hear from my constituents all the time. They're angry. They're frustrated. They're desperate. And I'm talking about everybody. I'm talking about shop owners on Church Street. I'm talking about people living in the neighborhoods. I'm talking about folks who don't have homes. And so one particular line in this testimony really jumped out at me, and I feel like I have to highlight it. Simply shifting the responsibility to the community level will not solve the issue of inadequate funding and resources, even as it adds in more flexibility and creativity. That's what we're doing right now, and our municipalities and our towns cannot do this. So I so appreciate that we're looking at a long-term structure, and we're doing the same thing, by the way, in healthcare and education and housing. We have like immediate crisis, and then we have long-term systemic needs and change. So I really appreciate this. I really want to help people right now, today, this minute. And I haven't read the bill yet, so I don't know what it does to address that particular piece of the crisis, but I thank you for listening, and I felt like I had to share that because it's really a desperate situation right now for many.
Thank you. Well, we agree. And I think it's meant to be what we do at Community Action every single day. And we're all Vermonters and we live in our communities and experience that. And I think it's hard because I think if we, like you said, in other areas in Vermont too, we want systems to change. We want it quick, right? And it's really hard to think about transformation in a fast way, right? So how do you build up and face something when we do have an immediate problem? So I think we're trying to offer a way that there's a path
So one of the things I think we're sharing with you is one of the things that we learned when we went through our healthcare bill recently, and we had some data come from unpublished data about what happens to the economy when the cost increases and the economy goes down and healthcare outcomes decrease. So as we're considering additional resources and change to the system, we're also, and I'm going to continue talking about outcomes measurement and what we can do for that. We're seeing every year we hear we need more, we all need more, we do need more. We understand that to move people off the streets and into shelters and more permanent places to live. We want to know that it's making a difference. So I see you all shaking your head, so I know you've thought about this. I want to hear I think I can hear your thoughts. It'd be great. About both what Senator Gulick was saying for additional resources and the difference that can make for what we're seeing in our communities. And I hear from my municipalities, especially Burlington, all the time, who would like to.
So
For the record,
I'm Josh Davis from Brattleboro. I'm also the director of SEPCA, Southeastern Vermont Community Action.
Yep.
Thank you so much for having us here today. I really appreciate the questions. In my vantage point of this bill, it does very little for the short term. And so if we're looking at the acute situation that's happening with people coming out of the motel, that's not addressed in H 911. And so we're really looking at the long term of systems and transforming systems. I think you're absolutely right to focus on what are the measures of success, so that we can be very clear about what this program does and what it doesn't do. This program is not going to end homelessness, but this program can help support better outcomes. And we need to have more time to establish what those metrics are, both internally with the 5 of us, but also in concert with our community partners.
yeah, so I mean, you for Brattleboro, I've heard from Groundworks, I've heard from COTS, I've heard from other organizations that currently are very much engaged in this process and want to be a part of it and are concerned that, you know, that they be in the mix. And I do think it's critical that whatever happens here, that you folks are fully engaged with the housing community, ACCD, your local community organizations, that the outcome for success is that measurement of access to a place, a shelter, a place to live, whatever it is. So are you doing that? I see Paul, you raise your hands. Go ahead.
Josh,
Please,
for the record, Paul Dragon, I'm the director at CVOEO. I think the question that Josh was getting to, and what we all have is, when we continue doing what we're doing, or do we move to a community-based approach? And I think that's where there's possibilities. Jenna referenced the State Advisory Committee. We would prefer working through our local continuums of care and the housing coalitions with this flexible funding and planning teams at each region to really dig into what I think could be some short-term solutions. And more importantly, we have to think long-term. We saw the budget that Lily put up and how that funding grew over time. And homelessness has also grown over time, and that's for a lot of complicated reasons. Vacancy rates, housing stock, mental health, substance use. We have an opportunity to drill down at the community-based level to use the hotel money flexibly with our partners to do this work. And we would work, our advisory committees would be working with the continuums of care. That money would be for the COTS and the spectrums and everybody else. That's how we would administer and coordinate this program.
Okay. And as we go through the bill, we'll be keeping that in mind. And also how we measure the measurements for success. We really need to do that. Otherwise, we just go on forever.
And we have strategies that work in some areas, right, in Vermont, and some that don't need those same strategies, right?
Right.
That's why it's important, like in the Northeast Kingdom, NECA, we operate the shelter, we do the apartments. So like we're already managing that piece, but we don't have anything to do with the TA program. So, and looks very different in Burlington, right? Like you have multiple community providers that are doing shelter work, not just CPO. Yeah. So I think like if we were to work with our local continuing care and build out what resources are already available regionally, and then building that system to help people.
Is anyone here gonna talk about what we can do today at all, what we can do? Brenda is, okay, great.
We're gonna get Brenda up in a minute.
Are struggling.
I know she's chomping at the bit to testify. We will have you testify. Let's, we'll do that. Go ahead.
Paul Dragonis, CPOEO. Again, I do think there are things that we can do in the shorter term. And I know the hotels have been a difficulty around the state. And at the same time, they've helped people who do need it. But if we envision using that hotel money to reinvest it with our partners in something that looks dramatically different and making sure that everybody in the hotel is connected to a housing plan, just like we do now at our shelters.
That was an answer to my question, I think. That's very helpful.
It's one of the outcomes, Senator, and we'll
Yeah.
be developing them with our partners over the planning year, the rest of the
Yeah.
outcomes.
Right. So, you said you're not connected to the GA program.
GA is administered right from
I know,
ESD, not from the community action agency.
but you're seeing the effect of the GA program.
In all of our communities, right?
Oh,
The effects and the good effects of the GA program, the
I think there's,
positive effects.
there's all sorts of impacts,
Okay,
right?
yeah, we just find out.
is there anyone else from who's here from the CAPS who would like to, say something at this point that would help us understand what's going on in your communities? Or what would happen in your local areas with H91 VHAR?
Allison Calderera, a co-interim from Capstone. I'm here with Sarah McMullen. We need to have a more robust community-based system in Washington County. Some of the things that we have seen work are working with our private landlords, which we haven't really talked about too much here, but they're going to be absolutely critical to help us develop more housing. We had a landlord liaison model in Lamoille County that was really successful. And that's something that should be spread across the state. So I think that this would give us an opportunity to be able to think about those interventions from a community-based approach that would give us this. I also think it's really critical that right now in the motels, and Paul, you touched upon this, not everyone who's in the motel is engaging in service. Not everyone has a housing. And I think that that's a really important critical measure if whether it is to be able to engage people where they are in terms of bringing them along in their housing plan. So I think that there's aspects of this that are really critical for us. And I see some basic interventions that can happen at the community that we just don't have the flexibility right now to be able to do it. So I think we are all on board with this. And the last thing I'll say is that in terms of Capstone, we all provide data to CSVG. And included in that are indicators around homelessness. You know, one of the things that we really haven't, we talk about people on the street, but we're not talking about the evictions that we prevented last year.
Yeah.
So we prevented 53 evictions last year. That is 53 people that did not end up on the street. We don't talk about that enough, and we don't resource that enough. So housing retention, landlord liaisons, master leasing, these are all things that we're not investing in them enough. And I think that those are things that really need to be talked about at a community level.
Why are we not investing in those enough? Because I do hear about that. And I know, for example, COTS in the Chittenden County area does an amazing job with
They do.
things that you're talking about.
They
And they
do.
have for many years. If we could emulate that, that would be awesome.
Yes.
yeah, so how will, so at the local level, you feel this will improve because you'll have the resources to do it?
I
Or,
think we will have more resources to be able to do it, but I also think that we're working within a system where we can find and leverage more resources. You know, I think that working with our community partners, can we subcontract? And those are all things that could be part of a plan here. The other thing that we touched upon here that I think is really critical that we haven't touched upon too much, but you did, Senator, and that was the cross-sector approach here. Is that how important it is for us to be able to engage with healthcare, for us to be able to engage with the correction system, to be able to engage with folks that are emerging out of substance abuse facilities with no plan in place. Those are all things that we need to be thinking about, engaging in, and finding a solution with, whether it's with our state partners or whether it's with our local partners. So I see hope and possibility and opportunity in those systems.
Just want to add one more thing that at a
you know,
local, that doesn't show up, I don't think, in data. It's the value of a relationship.
Yes.
And at the community level, if we have an intake process, but
Yes.
human to human and not through a call, through a state office, that people are sitting with people and forming those relationships and trusting. I think Sam, Senator Douglas, your question around, an individual who might be in a shelter and who's offered a lease and they don't do what, they'd expect them to do. Like in shelter, our staff explore those barriers and help participants with the form and do the visit and break down what's the resistance of. And sometimes in shelter, people feel safe for the first time and they form relationships, and living in their own apartment is terrifying. But it could look like from a statistical, oh, that person's still in the shelter or they're still in the house, right? But meanwhile, the value of that relationship is doing that coaching and mentoring and just being there every single day and proving to be a support person that's going to move a person out of shelter into housing. And I think the value of the relationship at community level can't be right.
So can I have a question? So this is a question we're asking across the board again, in all areas. But we're putting a lot of responsibility on the local partners. And I'm wondering, even with more financial resource and support, will you be able to find a workforce to do this heavy lift, this big kind of work?
I can't speak for everyone, but I think that at our community action agency, we have been able to fill positions around housing support. We also are really committed to investing in our community members with lived experience who may have experience in that sense and are really strong advocates and understand systems and what it's like to have that experience.
is there anything else that you folks want to share with us that will help us? You have a lot that you're going to share with us. We need that going forward, and taking very specific testimony on H91. There's a lot in that bill. And one of the underlying questions will be separation of the GA program from what you're doing. And right now it's muddy, and I can't see how it's going to be any different going forward. So I'm going to need help understanding that, really. And what will the state be doing? And the state will be allocating funds to you, and what you'll be doing and how that all sugars off, right? We're a lot there. Yeah, there is a lot. It's huge. So I'm gonna give Brenda an opportunity to speak. Oh, hold it.
Wait, Sarah and I are from the Vermont Network Against Domestic and Sexual
Oh,
Violence.
yes, you are.
We did not want to
be grouped in with the
No,
caps where we have
You
separate.
are gonna testify. I'm gonna have Brenda come up and
Okay.
I'm gonna have you come up.
Okay.
You're on the list, don't you worry.
Yeah.
Thank you for doing that.
I just want to offer too that if I get bumped to a different day, it's not the end of the world. If you're feeling crunched today.
No, this is fun.
Okay.
We do have fun.
Is there any chance, I am losing my eyesight, as many of you know, and if that light right there, is there any chance to close that top one or?
Kiki, can you reach that one or not? We should not. It's not a tall human being in the room.
Thank you, Frank. I'm sorry.
Now Frank's gonna come back and testify at some point too.
Yeah.
Oh, it's no problem.
Oh, that's much better for me.
Sorry,
Thank you.
your eyesight. That's.
It is very frustrating and it's still not.
So would you, Paul, mind turning the lights up a little? It's not all the way up. Oh, us.
Sorry, I'm like turning into.
That really worked.
That's up all the way.
Yeah, I know. Wow. Okay, well, we're having a candlelit meeting.
Okay, I apologize. I didn't submit testimony yet. I heard yesterday, but for the record, I'm Brenda Siegel, the Executive Director of End Homelessness Vermont. I also sat on the General Assistance Emergency Housing Task Force as representative for Vermont Center for Independent Living. With the majority, voted with the majority, so the report that you have are all our recommendations. I'm going to name two other hats that I wear just because it is part of this process and comes up a lot in homelessness. And that is that I work with a national organization on heading up policy on the overdose crisis, national policy, and have been working across state and country on this issue as well. Many of you have heard from me on that. And I have experienced multi-generational loss due to overdose, as well as my own housing insecurity and lost all of my housing and belongings twice while I was raising my son. I do consulting work on human services issues as well, and they are intersect almost entirely with homelessness. And Homelessness Vermont, and I apologize when I lose my place. But on Homelessness Vermont, some of you know, but I haven't come in for this reason for some of the new people. And Homelessness Vermont is a lived experience, expert-led organization that works towards the goal of ending poverty and disability discrimination and homelessness in Vermont. We provide a data-driven safety net to the safety net that is trauma-informed and rooted in compassion, empathy, and housing-first principles. We are effective at working closely with teams of providers, helping people remain sheltered when possible, and having the support that they need as they become unsheltered, as best we can, the support that they need. That's blooming large right now. We work closely with providers, economic services, Department for Children and Families, hotel owners, and most importantly, those experiencing homelessness. Our point of contact is generally at the moment of an emergency or in troubleshooting a complex case with other providers. Our primary clients are people living with disabilities, health conditions, or complex needs, and in complex situations. And we also work in an ongoing capacity with over 400 households who need additional support due to their complex needs. And we just recounted 196 people with renewing their vouchers due to the disparity of their disability, health condition, or trauma. At this point, I do want to say that what we're currently doing with the implementation of the executive order is extraordinarily challenging for our team. Extraordinarily challenging because a large number of our clients either meet the executive order or really were left out of the executive order, but still have extremely complex needs. And us managing how to get through the implementation of the system, which keeps changing, is really difficult, which is part of the reason I'm excited about H91 is because I do think it gets it into the hands of experts and away from these constantly changing policies that actually sometimes cause more harm than good. We have two offices at End Homelessness Vermont. We have the Office of Housing Advocate, which is where we do all of our emergency work, all of our case management, housing case management, and where we work with clients on connecting them to services and work with providers. And we have the Office of Research and Advocacy, where we do have research. We have an ongoing study happening right now. We finished phase 2, and it's in the hands of a public health researcher at the moment. So soon we'll be out. And over the last several years, we have been an instrumental part of implementing each and every general assistance emergency housing change that with the hotel program, with a lot of misunderstanding about the people that are in the programs. We know that the people in the programs all meet a vulnerability category even before we made eligibility criteria, and that about around 90% of people either have a health condition or are living with some kind of disability. And so the complexity of the needs are critical, and whether or not somebody has connection to a provider matters. I want to just dispel a myth that keeps getting repeated, which is that people don't have access to services in the hotels. That is true. There's geographic inequity, but in many of the hotels, there are providers, us included, entering, working with clients, staying connected to clients. And in our organization, if they are, let's say in Washington County, and it's someone living with schizophrenia and who tend to travel about the state quite a lot, and now they're in Windham County, we continue to stay with that person, connecting them to services in whatever district that they're now in. So I think it's really important to understand there is work being done in the hotels with people in the hotels. The problem is there's not enough housing, and there's not enough resources for any of us to get to everybody. Some of what we provide, and this will be critical in H91, is emergency support for people experiencing homelessness, ongoing support for maintaining shelter for individuals with disabilities or complex barriers, representation of people in fair hearings. Legal aid does a small portion of these hearings, and we do the other portion. And additionally, we conduct voluntary interviews for data, as I was just saying. We support people with lived experience experts in self-advocacy, many of which you have heard from them. We are putting together a comprehensive statewide guide, which 211 beat us to, and now we are utilizing their statewide guide to put together ours. Additionally, we are working on systemic challenges, both with shelter and housing. And then we support people, this is little known, but we support people in, once they transition to permanent housing, we help support people at the point of emergency all the way through. I will include more about our organization in my written testimony, and feel free to ask any questions.
Good.
We have to begin to think about emergency shelter as a path to permanent housing, not a shelter that is temporary, regardless of if permanent housing has been found. Our fellow neighbors and community members are worthy of being sheltered, or at least have a safe place to lay their heads. That should be basic dignity. Last year, when we sat before your committee, I said that non-congregate shelter must be provided for as long as needed, and I announced several risks that could happen. I sat before your committee recently and told you that the outcomes that did happen this past fall, including in this one terrible week, there were 7 deaths. Currently, right now, as people are being unsheltered today, one of our clients is in her first trimester of pregnancy, carrying twins, and will be unsheltered today. And we have another client who is a veteran and who wasn't sheltered yesterday. And I could go on lists just like that. So I say now, after staff and providers have across the state experienced the moral injury of having to carry out this harmful policy time and time again, that, and most especially in the last 8 months, knowing that we are all experiencing this right now, everyone that's sitting around this room, that what I like most about H91 is that it stops this cycle of harm. It stops the battles in the legislature, thank God for all of us, about if or how people should be sheltered. It removes this from a political fight about who is worthy to stay alive, and instead puts it in the hands of experts where it belongs. I am not just speaking about the CAPS, I'm talking about the community shelter and service providers, I'm speaking about COCs and all the partners. All of us have been trucking along doing this work as partners together and can be trusted to continue to work as partners together. The most critical thing I will say today is that however this bill leaves, it should not be too prescriptive. If the idea is for the communities to come up with more creative solutions to meet the needs of their communities, then we must be allowed to do that. Prescriptive language about who this can serve will be rejected by the majority of providers and organizations on the ground. I mean, they literally won't do it. That is what I've heard. So, if the administration wants this to be sent to communities and the legislature, rather than to state government, then also the micromanaging, the constant arguments have to end. We have to be able to do the work. Yeah. Well, I don't think that.
You're gonna submit all of this.
I will submit all
All
of
right,
it, yes.
good.
Maybe, no, okay, so, some recommendations that I have for H91. And for right now, I'm gonna start with for right now, for Martine. For right now, sorry, for Senator Gulick, apologies. So for right now, I would recommend that we keep people sheltered continuously while this transition takes place. Because I'm sure every CAP, every single provider in the state is right now is in an absolute crisis. None of us can barely think. And that is also the clients that most importantly, the clients. So in order for us to actually do this work and do it effectively and do it well and get ourselves out of this crisis, we have to stop doing this to people and we have to stop doing this to the providers. I have not been well in the last 2 weeks trying to do this work, and I am not alone. And people, we understand that empathetically when we talk about nurses, when we talk about doctors, we talk about other kinds of providers. But homelessness service providers, we seem to be okay letting us continuously experience this type of secondary trauma and moral injury, and that has to stop. So we don't have the capacity to continue to do this way anymore. So that would be my recommendation. It's simple. It's for some reason partisan, but it shouldn't be partisan. So
Brenda, can I just say, it's a moral argument. It's also an economic one.
Right.
And we need to make sure people understand that as well.
Right, and I actually left this out, but I'm gonna say this one part, which is that the cost of homelessness, the cost of unsheltering people for us was we spent $40,000. We're incredibly have low funding for our organization. We spent $40,000 last fall. We know that more money was spent by other organizations. We were able to do some bridge funding to keep some people with complex needs sheltered. We do not have the funding for that this time. 10,000 of that was on tents. I was able to spend 1,000 this time. And we know that it costs roughly $35,000 according to a study in 2017. So with inflation, that would be higher per person that's experiencing unsheltered homelessness. And that's $105 million a year for all the people who are experiencing homelessness right now.
Not to mention healthcare costs.
Right, and so that's all in there. So it's like an emergency room, which I'm sure you'll hear from Frank, but around $1,700 for an emergency room night. And again, this is an old study pre-COVID, and a hotel room is $80. So it really is important to keep in mind what the cost is of not keeping people sheltered. So throughout the bill, I can give more prescriptive language in my written testimony or come back.
So we're not too prescriptive. You're gonna give it.
Right, I mean, prescriptive language, yes, exactly. Don't be too prescriptive, but I'm going to take that liberty right now. No, but I can come back with specifics on the bill, but the overall concerns and support that I have for it. We support the findings section. And the intent section we support with one suggestion, which is that, that statewide, that there's an inclusion of statewide components of an emergency and transitional shelter program are integrated in a systemic manner in regional planning in order to address unsheltered and sheltered homelessness, as well as populations that require support for statewide services or agencies.
So it is important that our regional planning commissions be engaged in this, so but that's.
And In emergency shelters, I would change the reference to transitional shelter. I know this came up when Katie was going through it, to interim shelter instead. Transitional shelter is confusing.
You do us a favor, I think. To finish this up and then make sure we get this. Because these are specific comments and I know the CAPS have similar specific comments that they haven't made today, but. I
Okay,
think
yeah.
Generally,
So I'll just go with the general ones and send you the specific
Yeah.
ones. Is that okay?
Yeah.
Okay, so, I want to make sure that people have choices in services. I'm concerned that it still is not clear in the bill that, that the CAPS and that the providers would work specifically so that people have their choices, like a housing first model. And on the advisory committee, I want to support the CAPS in suggesting that perhaps that is not needed. Because I think that that we need to get it. It's not needed. We don't need that. And it just, and it kind of can be a little bit, paternalistic. And then these are things that are not in the bill. So there's a minimum standard of rights for people in the hotels or in other hotels. Because that comes up a lot to our organization. People say, I have rights, and then I have to inform them they in fact do not. And that is not okay. We should have some rights, minimum rights. And the last thing that's very important to me is that the state, in terms of the statewide organizations, the current bill completely lacks language that is consistency across regions that ensures geographic equity. And it is unclear how statewide orgs are supposed to participate in this process. With the goal of moving everything to communities, we need to make sure that we include that. And we had a couple of suggestions. One was to put together, there's two statewide organizations actually that work on emergency housing and housing that work with people with disabilities, which is Pathways and Homelessness Vermont. But we thought with VCIL, it would be good to have a planning committee between the three of us that then interacts with the CAPS about how we are supposed to integrate in this system, this new system. And also how we are supposed to make sure that when someone goes from one district to another, they are connected to, especially if they're living with a disability or complex need, they're connected to whatever service they need so that they have a consistency in care. Those are the most important things. You'll also see the ability to port a voucher into temporary subsidy for housing instead is something that I keep suggesting and hoping that one day one of you will take, because that would allow us to put people into permanent housing. Our organization had the opportunity to put 20 people with complex needs into permanent housing, but we didn't have voucher access. Meanwhile, the state is spending $2,500 a month on them being in a hotel. It would be much less expensive for us to be able to actually just port their hotel into a voucher. Thank you.
a lot. So thank you for your thoughtfulness on that and get us the written testimony, send it. Great.
I have to organize it first.
Yeah. Organize it.
Yes. Thank you.
Thank you. Good. So Sarah, you are here. Thank you for being here.
Yes.
And so, obviously the network is named. The network is very much in H91 and also in the language we saw about eligibility determination. So
Yes,
Yeah.
yes, thank you so much for having me.
yeah,
Feels positively luxurious to sit after standing room only morning. Even in this chair. I'm enjoying it right now. I'm
a
enjoying it.
rotation in here for seats. So when the bell rings, everybody gets stuck.
For the record, Sarah Robinson, I'm the co-executive director of the Vermont Network Against Domestic and Sexual Violence. And thank you so much for having us in. Just want to say I'm joined by my colleague, Kara Casey, who's our director of economic empowerment, our real expert on a lot related to housing. So I may defer to her as well. But we really appreciate the work that you're doing to take up H91, and we worked a lot on this bill in the House and look forward to working with you all in the coming weeks. We are the state's leading voice on issues related to domestic and sexual violence, and our coalition has 15 member organizations who provide direct services to victims of domestic and sexual violence in every community in the state. And those organizations provide services to victims and survivors fleeing violence with shelter, motel overflow, transitional housing, rapid rehousing, and accessing the General Assistance Emergency Housing Program. Domestic and sexual violence is one of the leading causes of homelessness, not only in the US, but here in Vermont. The National Safe Housing Partnership reports that over 57% of women experiencing homelessness report that domestic violence was the primary cause of their homelessness. And in 2024, our member organizations provided emergency shelter and transitional housing to 1,461 individuals and nearly 500 children. And housing instability and economic insecurity also result from many survivors of domestic and sexual violence remaining in unsafe situations and really facing untenable choices between safety and homelessness. So as you contemplate changes to Vermont's temporary and emergency shelter system, this proposed framework must consider the needs of survivors, which are a distinct population with unique needs, systems of care, and also federal and state laws and policies that dictate how these organizations provide shelter and case management. For example, federal law prohibits domestic and sexual violence providers from using HMIS, the Shared Homelessness Database, or providing identifying information through the coordinated entry system. And so homeless survivors also require different wraparound and supportive services, and that's the work that our member organizations do. It's for these reasons that we worked and advocated to include these services in H91, building on current practice and funding through the Office of Economic Opportunity. So Section 3 of the House passed bill establishes a program within VHARTH for shelter and supportive services for victims of domestic and sexual violence to be administered by a statewide organization serving victims of domestic and sexual violence. Since we are the only one, presumably that is us. And through this program, funding will then be distributed to our member organizations via a funding formula. That funding will provide shelter and supportive services in a manner that meets the unique needs of those living in shelter and being supported by our member organizations, and also that comports with federal and state confidentiality requirements and other statutes. We appreciate the framework established in H91. We've been listening this morning and appreciate so much of what our partners at the community action agencies and others have shared. We do have some specific feedback on H91 that we'll submit to the committee. But big picture, depending on where the committee goes with the advisory committee structure and whether something exists at the statewide level or whether that occurs simply regionally, we do think that it's important that there's representation from our field on those advisory committees, whether that's at the statewide level or at the regional level. And we would echo what you heard from the CAPS about the appropriations. So the appropriations section of the bill currently allocates $6.5 million to be distributed by VCF to the CAPS and for our work to establish a system to fund our member organizations who do this work. And we believe that the committee needs to specify those allocations further. We believe that it will take us about $400,000 a year to establish the systems that we will need to implement the VHARTH program as it's laid out in the bill.
Are you suggesting that somehow during the appropriations process, we begin to parse out and allocate individual organizations? Or that's what I'm hearing you say.
I believe that the appropriations section of the bill, there needs to be further testimony. You obviously heard a larger number than 6.5 from the CAPS. And we're letting you know that we believe will require about $400,000 to accomplish the work that's set out in the bill. So those are that's the big picture from us. We appreciate that the needs of survivors are addressed in the bill, and we'd be happy to answer any questions that you might have.
And can I also just, say there
On
has
the
been,
record,
for the record, my name is Kara Casey. I work for the Vermont Network. There has been a lot of talk about the GA, program and the hotels, and I think that, our member organizations have been doing something a bit different, not in every single region, but there is a goal of this being a statewide thing where our member organizations actually through the HOP grant get a separate pool of funding that we call motel overflow. But in many regions of the state, if a survivor, if there's not room in the DV shelter, or for some reason it's not a safe or appropriate place for them, they are able to, that DV organization is able to say, okay, we don't have room in shelter, but we have an established relationship with a particular motel, and to be able to pay for that survivor to stay in the motel as opposed to referring them to 211 or the GAA program. And then what I've heard from our member organizations is that it's helpful because they get to kind of set the rules, and they also get to move a survivor into shelter quickly once a room does become available, so they're not staying in the motel as long. And so this would be something that our member organizations are accustomed to doing and have been doing some for many years, but we would then move it to a statewide.
And just to, thank you, Karen, just put a finer point on that.
so just and help me here, is this currently in the bill? Is there something in here on this?
The bill allows for this as it's currently constructed. It's not happening in every region of the state, but it's something that we'd like to move towards statewide consistency around.
And how is that rule written? Who writes the rule about that? Who puts that in place for the statewide?
Right. Well, right now that is being funded through OEO through the Housing Opportunity Grant Program. And so it's being funded regionally to our member organizations. But I will just say, domestic violence and sexual violence shelters across the state, they are full. They are completely full. And when I came to the network over 10 years ago, it was not uncommon for people to come into shelter and stay 30, 60, maybe 90 days. And get some real intensive case management, a lot of support, get their feet underneath them a little bit, and be able to move on to safe, permanent housing. We now have survivors who are staying in shelter 6 months, 12 months, 18 months, because it is so difficult to find affordable permanent housing. So our shelter system is just very backed up. And so this motel overflow, I'll just say in Chittenden County, I was just at our program Steps to End Domestic Violence a few weeks ago. They have 35 children right now living in their shelter on site, in families and in transitional housing. And they have arrangements with another motel where they have a block of 18 rooms. And so what they're able to do is they actually send an advocate, a staff person, to that location. They're providing intensive, again, case management support and advocacy to families who are staying there because they don't have room in their shelter to house them. And as soon as families leaving their shelter into permanent housing, they're able to move those folks into a more transitional and supported place. So again, we're trying to identify all of the assets that can be used to ensure that folks who are fleeing violence are not making that really difficult choice between staying in a violent and unsafe situation and unsheltered homelessness.
So you're seeing an increase, obviously, in domestic violence. And is that what's the relationship between that and the pandemic and access to motels and overflow in your shelters?
Great question. We certainly have seen an increase in the number of calls to our statewide domestic violence hotline since the start of the pandemic. 2020, things got very quiet, very eerily quiet for a period of time when people were sheltering at home. But since then, just the complexity, the numbers and complexity of survivor seeking services has grown. As many providers that you've heard from today, our member organizations are helping support folks that have mental health, substance use, and are experiencing violence. And there's a lot of complexities in terms of the case management and supports that those individuals need. But we have seen growth in the need for shelter and the need for domestic and sexual violence advocacy throughout the pandemic and after.
And obviously for all of us, we've seen a lot of support disappear from the federal government as, ARPA funds gone.
Yes, and
It's difficult, and trying to have the state compensate for all of that has really put the pressure on all of us.
I understand that many fields are facing very difficult choices ahead. I've been trying to compartmentalize that in this testimony, but to say that our field has been very uniquely impacted by federal cuts. We're very, very concerned about our member organizations. Most of them are between 50 and 90% federally funded. Very concerned about their ability to continue to provide the level of services that they've been providing in their communities if they don't have access to those federal funds.
Can you end on a happy note?
So part of the HOP program that we've been engaged in for many years is that we actually apply as a statewide entity. And this year we have, I think it's $165,000 for financial assistance to survivors. And we're slated to spend all that by the end of June. And so what that provides is we're able to keep survivors housed. They have been sent an eviction notice. It's usually because their abuser has left the home, they no longer have that income, or they were told that the rent was being paid and it's not. But we're able to support those folks in providing them with some rental arrears. And we have seen progress in people moving into housing, and we're able to support them with security deposits, with first month's rent, and with moving assistance either into a new rental unit, or we have seen folks be who are supported by family, and they're like, hey, I have a family member in another state, and if I can just get some funding to help me move to that other state, I have a safe and affordable place where I can heal and be away from that violence. And so being able to be on this end, I don't do direct services, but I do get to see all those like happy, like, oh yay, you got like this person got housing, like they're really excited, and and so that's something that is a good note. People are being housed and people are moving. It's just slower, but it's happening slowly.
Senator Cummings.
Yeah. The link I haven't seen, and maybe you have it better than others, is we've been building affordable housing. And we have shelters, but who makes the link between your families and the new apartment building we're opening in Morrisville or, Brattleboro? And is somebody responsible for those links?
That has been kind of the elegance of the coordinated entry system. Is that, it's an opportunity for all providers to come to the table, to look at a list of individuals in their community who are in need of housing, to have those individuals prioritized, to look at units that are becoming available, and to work together to house those individuals. So I think that is a strong system that again is preserved in H91, and our member organizations are active participants in coordinated entry process. Again, it's a little different because we're not providing like names and identifying information. So our advocates actually kind of represent the interests of the homeless survivors that they're working with.
Okay.
And I will say, I often see the names of the same landlords popping up. So like once somebody is successfully housed with a landlord and they build, that we kind of build that trust and relationship, a landlord is more likely to accept someone that's maybe, coming from one of our organizations or shelter. Yeah.
This is not action news, it's more of a question really. I'm assuming there's a correlation between domestic violence and economic instability. And on top of everything else, I'm so worried about like the economic outlook.
Yeah.
I assume there is a correlation.
It is the number one reason why people stay in unsafe situations. And it is not only a creator of poverty. But yeah, it creates significant economic hardship for people who experience violence, so unstabilizing and to their economic well-being.
Yeah, and I have been thinking a lot about and being on lots of webinars around the impact of federal cuts to safety, social safety net programs, and that will significantly impact survivors, because we know that they're, like programs like Reach Up.
Yeah, but also just the economic instability effect on the individual's mental health, for example. It's something I'm thinking about a lot.
Yes, I think that is absolutely the case. And as families experience increased stressors, there's a whole host of complications that can come.
Thank you.
Yeah.
Good. Thank you all. This has been great. Half great, half not. but- No, it's concerning. We've been working on this for a long time. I will just share with you, because we're gonna we need a break after this. This is a lot of heavy duty information from each of you. But I have heard that as the bill was developed, that some folks didn't have an opportunity to testify on H91. I'm thinking that you all were in the room after it was developed, and did you testify on the bill after it came out? No, no one did. I didn't think so. So we have to play catch up on that. Just so you know, it's going to take us time to get where you have landed. And there are a lot of questions that we have regarding how to shift the funding and the decision making more to a local level. How to measure outcomes, that for me is really important. What role does OEO continue to play? How do you get the data about entry and how that sugars off if you get down below? I mean, there's a whole lot here that we need to understand and what works and how prescriptive we should or should not be. We've been careful in here as we were doing our healthcare bill, not to be overly prescriptive on what regulation the board would do, the Green Care Board would do, and we want to similarly not be overly prescriptive, but at the same time ensure that we're getting the bang for the buck, right? So this is all, and that people are where they need to be when they need to be there. So anyway, I can't say thank you enough. It's been really rewarding to have you here, and I think we'll probably be seeing some or all of you again, and we appreciate the time you're putting into this. Thanks. We're gonna take a break until 11.